The Hollister extended wear urinary external catheter is a self-adhesive latex catheter designed for easy application. The catheter features a unique applicator collar to help position the catheter and simplify application. The unique inner flap, which rests on the glans of the penis, is designed to prevent backflow of urine. The inner flap not only helps to protect the patient's skin, but also assists in preventing urine from undermining and loosening the catheter. The double row of convolutions near the catheter tip is designed to prevent kinking and twisting, so the fluid pathway can remain open and can drain freely. Finally, the tapered tip helps to provide a secure connection to either a leg bag or other urine collection system. The Hollister extended wear urinary external catheter is available in 4 sizes. The product packaging is color-coded to help simplify selection. Using the correct size catheter is important both for patient comfort and to help ensure maximum wear time. To determine the correct size catheter, use the Hollister Catheter Sizing Guide, which is also color-coded to match the product packaging. Before measuring your patient's penis, wash your hands thoroughly. Next, put on gloves and wash your patient's penis with a mild, non-oily soap and water. For this demonstration, we are using an anatomical model. Do not use lotions, powders, or emollients on the penis or in the water, since those products can affect adhesion of the catheter. Dry the penis and remove any lint or other material that could affect adhesion of the catheter. Next, use the Hollister Catheter Sizing Guide to measure your patient's penis. It is important to measure the penis at the point of its greatest circumference, whether the widest point is at the glans or along the shaft. A catheter that is too small can cause discomfort for the patient. A catheter that is too large will not fit securely and may result in decreased wear time. For our anatomical model, the correct size catheter is intermediate, 32 millimeters. Discard the sizing guide and record the catheter size in the nursing care plan. Next, assemble everything you will need at the patient's bedside: the appropriate size catheter for your patient, gloves, a Hollister bedside drainage collection system or urinary leg bag with leg bag straps, and extension tubing. Next, remove the catheter from its packaging. Then, place your thumb and index finger into the finger cuts on either side of the plastic applicator collar. Inside the catheter, you can clearly see the unique inner flap. Squeeze your thumb and index finger together until the inside surfaces of the catheter are touching. Next, while still holding your thumb and index finger together, position the catheter so that the inner flap fits over the glans of the penis. The position of your thumb and index finger will help you to position the catheter correctly and will also help prevent the inner flap from being placed too far forward or too far back on the glans. The tip of the penis should protrude only about 1/4 of an inch past the inner flap. If your patient is uncircumcised, let the foreskin remain in its natural position as you apply the catheter. Next, simply unroll the catheter along the length of the penile shaft with as little wrinkling of the latex as possible. As you unroll the catheter, a drawing motion toward the base of the penis rather than a pushing motion may help prevent your glove from being caught in the adhesive. Next, remove the plastic applicator collar and dispose of it properly. To ensure that the adhesive inside the catheter is adhering properly to the shaft of the penis, gently squeeze along the shaft. Do not attempt to reposition the catheter once it is in place on the penis. Check for a secure seal and close any wrinkles in the latex by simply pinching the excess material together. Because of the adhesive coating inside the catheter, the latex material will simply adhere to itself. If your patient's penis becomes erect during the application, wait until the penis becomes flaccid. Then, check the catheter for a secure seal. Once the catheter is in place, you can connect it to either a urinary leg bag or other urine collection system. Simply push the extension tube connector into the tapered tip of the catheter to ensure a leak-proof seal. If you are using a Hollister urinary leg bag, connect the other end of the extension tube to the leg bag connector. Then position the leg bag on the patient's leg. If you're using a Hollister bedside drainage collection system, connect the extension tube. Then position the bedside collector to the patient's bed. Make sure the bedside collector is lower than the patient so that gravity allows urine to drain into the collector. Both the urinary leg bag and bedside drainage collection system may be cleaned with Hollister M9 Cleaner Decrystallizer. The M9 Cleaner Decrystallizer will help the collection bags to remain fresh and free from crystal buildup. The Hollister Extended Wear Urinary External Catheter will help to keep your patient dry and comfortable. Be sure to review your institution's policy to determine how long the catheter may remain in place on your patient. When it is time to remove the catheter, wash your hands and put on gloves. Gently ease the latex material away from the base of the penile shaft. Then, simply unroll the catheter down the length of the shaft. Finally, disconnect the tubing and discard the catheter. Before applying and connecting a new catheter, it is a good idea to clean the tip of the extension tubing with an antiseptic solution. As before, wash and dry your patient's penis before applying a new catheter. It is important to remember that the catheter should not be used on irritated or compromised skin. If you have a patient for whom the extended wear urinary catheter is not an option, you may want to use the Hollister male urinary pouch. The male urinary pouch includes a cut-to-fit synthetic skin barrier to protect the patient's skin, along with a convenience drain that can be attached to either a leg bag or bedside collection system. At Hollister, the range of continence care products forms a complete system for managing male urinary incontinence, a system of quality products designed for both you and your patient, a system of products designed to promote dignity and quality of life.